Hi, my name is Brian Varula. This is my special projects assignment number 6 over pulmonary function testing, and I will be getting started. What information will a pulmonary function test provide? So specifically, PFT, for short for pulmonary function testing, it will assess the lung volume, airflow, and gas exchange within the lungs. This information can help diagnose lung disease, monitor their progressions of that said disease, as well as assess treatment effectiveness and evaluate a person's ability to tolerate surgery. So you will need certain degrees of the PFTs. There's different types. I would say there is a very short version, and then there's the long drawn out version for more detailed responses, such as, and I think I have a picture in the next slide, but a bedside spirometry or a full-on, you're in the clinic, you're doing a full-on body box, and you're getting all your volumes, you're getting all your restrictions, you're getting all your airflows, you're seeing how much you are obtaining that goal of a predicted volume or predicted value, and seeing how you do against that, as well as diagnosing how much your treatment has been aiding you as a patient who's already diagnosed with the lung disease, and as well as the patient's ability to tolerate a surgery, whether they have a surgery coming up that will affect their respiratory system. They need to know if they're going to be put down under due to anesthesia. They want to be able to see that how long you need to recuperate yourself. Some patients can be very severe due to COPD, and they're not able to readily get off the ventilator quickly. But then there's some that that are healthy individuals, or they have a very mild stage of a certain lung disease, and they're able to get off after a few treatments, a few therapies in order to get off the ventilator. So I mentioned a little bit of this part, but what patient population and or / disease would need a pulmonary function test? So it is definitely indicated for patients suspected of having or are known to have various respiratory conditions, including asthma, COPD, pulmonary fibrosis, and other lung diseases. Usually the patient able to perform the testing would need to be a patient able to follow specific commands. So this is to say that you're not going to have a 4-year-old, a 5-year-old, possibly a 6 or 7-year-old able to do a pulmonary function testing because they are not able to follow those directions to the T. Of course, you have patients that are old enough to take this test, but that also have problems following certain testing. That's why you'd really want to practice having down how you explain the procedure to the individual, whether that's a younger patient or an older patient. Also being able to check their, making sure that they're just mentally able to understand you. There are some older patients that deal with that boundary, that wall that they hit all the time. I've seen a couple of those happen. So you could be reiterating a certain step in the procedure, and they are not able to follow it. So then you would just use your educational to really move past that if you have to. So, and the reason why specifically you're doing these for asthma patients, COPD patients, and pulmonary fibrosis patients, because you have a constriction, you have an obstruction there. You have something that is directly affecting the lungs' ability to function. So then you need to understand, okay, how exactly is it affecting it? How exactly are they unable to take in a perfectly normal breath? Like a COPD patient, they can get it in, but they can't get it out. Pulmonary fibrosis patient, they'll have very constricted non-elastic lungs tissue and unable to really get the adequate amount of perfusion that they might need. And then you have your asthma patients, of course. So if they ever have a situation where they have an exacerbation due to a trigger, then you have either non-critical or critical life-threatening situation there. And this is what I mentioned before in the previous slides, but you have two different types. Let's say you're a patient that's inpatient in a hospital, so you're unable to make that visit towards a PFT lab or a PFT clinic. They will bring to the bedside and have you perform certain available testing there. But if you need a full-on test where they can check your volumes, your DLCO, your pre and post broncholator testing, seeing if that's even having an effect with the medication that you're given, then you will have more of like a body box here in this situation. So you would have to go in person, being able to amputate as much as you can, being able to actually make that trip towards it. Because most hospitals have a PFT lab. Some don't, but most do. So if you can have the patient go down there to you or up wherever it's at, then you can do more intensive, more detailed testing. So the main components of PFTs for interpretation, what exactly are you looking for? One of the four main values that come to mind that you really want to hone into is a slow vital capacity, a forced vital capacity, forced expiratory volume in 1 second, and then a forced vital capacity over the forced expiratory volume in 1 second. This is your EFEV 1% over your forced vital capacity. So slow vital capacity, it refers to the maximum volume of air exhaled during a slow relaxed expiration from full inspiration to residual volume. You're assessing your respiratory function. In this case, if there's any airway obstructions or restrictions when it is suspected. Your forced vital capacity, it's similar, but in degree, this is going to be something that's hard and fast. It is the maximum amount of air a person can exhale from their lungs after taking a deep breath in. So again, this is going to be to diagnose and monitor various lung conditions. Your forced expiratory volume in 1 second. It is a crucial measurement in pulmonary function testing because it indicates the amount of a person can forcibly exhale from their lungs within the first second after a deep breath. So this is mainly focusing on your COPD patients and your asthma patients. So a forced vital capacity over forced expiratory volume in 1 is the percentage of forced vital capacity that a person can exhale in that 1 second. So during that spirometry testing, again, you're diagnosing and mostly staging the COPD severity. So that's for patients that have already been diagnosed with COPD, but they just need to know how bad or how intense that severity is. So these are my online sources as well, but I also did use my respiratory care examination book as well to find this information as well. Alrighty, thank you. This is my PFT special project assignment 6 over pulmonary function testing. This is video 1. Thank you again.